You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, sedation dentistry. And they fall into two categories. The people that are really afraid of the dentist and people just don't like going to the dentist. And there's different levels of sedation. And we have a very busy dentist that spends a lot of time and is known for the work he does with sedation dentistry. With us, we have Dr. Schlossberg. Dr. Schlossberg, welcome to the program.
Thank you. Good morning. Great to be here.
Now, your patients, you said they call you Dr. Rob.
They do.
Because you work with your wife.
They do. Dr. Rob or Rob. We're somewhat informal there.
So Dr. Deb and Dr. Rob.
Exactly.
Now, because people are afraid of the dentist, right?
They are. In our practice, very much.
Are they less afraid of a female dentist? Do they request your wife more than you sometimes?
You know, it's funny. Sometimes they do. I would too. Did you see her?
Yeah, she seems very nice. We're going to interview her on the program
right.
in a little bit. So for people that don't know your practice, and you brought photos. These are like extreme makeovers. I'm calling them extreme makeovers, but these are dramatic.
Good.
And you say sedation got them there.
Yeah.
But for people that don't know about your practice, who's the typical sedation patient?
Right. So for us, typically, patients come in, and they come in because they're, for years, have been way too busy with their life, their kids, their family, their work, and they just put their dental health on the back burner over and over and over again. We've got plenty of patients that come in because they've just had a horrible dental experience years ago, and it sticks with them. That's it. That's what they remember, and that's what keeps them away. Other patients, they hate the sight, the smell, the sound, all the icky parts of dentistry that people think of. That's what keeps them away. We can take care of all of that. So they come in, we've got different levels of sedation, different ways to keep them comfortable. A lot of them come in because we do a lot of sedation.
Because you're known for that, right?
Absolutely.
Well, you're on the radio.
So. We are. We're on the radio. We are out and about in our area letting people know what we do, very much so.
So is it true that like less than 5% of all general dentists are even doing sedation dentistry, IV sedation?
Yeah, very much so. It's probably even a smaller percentage than that. Especially in our area, there are not many practices that offer the level and kinds of sedation that we do.
So do you think it's insensitive when they say, you know, sedation's not necessary?
I don't think it's insensitive. I think that you know, we're all doing the best that we can do. We just so happen to be able to do things at a different level in our practice. We're able to keep people very comfortable, very safe, get them through the kinds of care that they want and that they need in a very different way.
Okay, good. Yeah. You know, I don't have a fear of the dentist. We talked about this in the green room.
Yeah.
At all.
Right.
And so when I was introduced to just nitrous for a cleaning, it was like, oh my goodness.
Absolutely.
It's like I couldn't wait. I didn't even want the cleaning to end.
Nitrous is great. I think nitrous is like having a drink or two when you go to the dentist. It's nice, takes the edge off.
You come right out of it.
You come right out of it. You care less about being there when you're there. We have the unique ability to offer several layers of comfort beyond that, all the way through IV sedation.
So you and your wife, lots of additional training. I guess you have one of these concepts, and I know it's not an official term, but a super specialist. You do your own root canals. You do dental implants.
We do.
You kind of do everything under one roof.
Very much so. We do. You know, over time, people that have lost trust and comfort in the profession, with our help, regain over time that confidence. They don't want to go out to another office or another place for this procedure and that procedure. They want to know that everything can be accomplished comfortably and appropriately in one facility.
So do you and your wife, Dr. Deb, have similar training?
Identical
training.
Same stuff? Went through dental school together, same postgraduate training and studying together. We both are doing the same thing in the office.
Now you brought some photos.
I did.
And we're talking about sedation today.
Sure.
And you say a lot of these people, their fear of the dentist or their so-called busy schedule kept them from doing it. And by the way, what are the categories? Like if you had to categorize these patients, what are they?
Too busy to make it in. Too much pain. I think I can just pop some more pills and deal with it for a little bit longer, and hasn't gotten to the point yet where I can't tolerate it any longer. Strong gag reflex, can't stay numb when I have dentistry done at other places, those kinds of things. I can't believe how much dentistry I have to have done based on other recommendations.
Okay.
I want to come to one place and get it done. I don't want to have to go all over the place as we were talking about before.
It might be less expensive to do it all in one place.
So that's a good point. So typically when we're doing dentistry with sedation, It allows us to be more efficient, accomplish more over fewer visits, which is great because you're in, you get through the appointments, you're back to your work, you're back to your family, you're back to your life as you know it, and you're not being taken out of your life more times doing dentistry the traditional way.
Okay, good.
Yeah.
So you brought some photos, and these are all people that what? Didn't like the dentist, afraid of the dentist?
All sorts of different reasons
Okay.
why.
Let's take a look.
Absolutely. Yep. So first gentleman here.
All right.
Okay.
Wow.
Yeah, I know. He's a gentleman in his 40s, and he has had a world of dental and overall big health issues. For him, he thought dentistry was just one more problem in his list of health problems.
Okay.
And it took quite a bit to get him back to where he is now.
That's got to be unusual. I mean, that's pretty bad.
Well, a lot of these patients are walking around and people don't know that this is what's going on with them dentally. They're not smiling. They're ashamed. They're embarrassed.
So we don't see it just because
You
they're
don't
not
see
smiling.
it. You do not see it. Not
Okay.
at all. Yeah.
And they say that to you, Doc, this is the worst that you've ever seen, I bet?
So everybody comes in thinking they're going to be the most complicated patient, have the worst dental problems, the biggest fear. Not at all. This is who we see day in and day out in our practice.
Okay, so what did you do for him?
So we had to basically start from the beginning with him. He had a lot of things going on, and we had to wipe the slate clean and start over with him and get him put back together permanently.
This is really nice.
Yeah. When he finished, the day we finished his case, he could not stop smiling.
Okay.
I think this was not an official photograph that we took with our proper camera. I think this might have been a picture that we just happened to take when he was there just grinning, looking in the mirror. He couldn't get enough of what his smile looked like when he was finished. So it took a little bit to get him put back together. He was an IV sedation patient every time he came in. And when he was finished, he didn't realize that things could be this healthy, feel this good. A lot of these patients don't realize the pain that they're suffering with. They just think it's part of their world. Who doesn't live with this pain is what a lot of them think. He didn't realize it didn't have to feel that way. It could feel good when he was finished.
Now, and you were saying that a lot of these patients, maybe their partner, their wife, their husband, drags them in.
Very much so. Yeah. So this gentleman, he's got some other medical challenges, and his mom had to be the one to
talk him into it.
Kind of give him a little bit of nudge and say, hey, you know what? I think it's about time for you to go and take care of yourself.
And is it true they have very little memory sometimes of
Very
the
much so.
procedure? Like they just had a whole mouth done?
Excellent point. Yeah. So with the IV sedation, there's little or no memory, typically zero memory at all, of being in the office, of having any of the work done. It's a great way to do things. I really don't know why dentistry, which is a procedure-based profession, actually evolved the way that it has evolved without some form of sedation.
So you feel like every dentist should be a sedation dentist?
Hands
like
down.
You? Really?
Yeah, absolutely. I think it's a great way to treat patients.
Okay.
Yeah, let me show you another one of these cases here, okay? So she had been a patient off and on in the practice for a number of years, always coming in for an emergency, a quick fix, throw a Band-Aid on it. I'll come back around and we'll get to some bigger stuff when I can. Finally, last straw, we had to take some bigger steps with her. She lives with her grandkids. She's got a busy, active life. She didn't want to deal with dental issues anymore, dental pain, things breaking, the unpredictability of it. She needed something that was going to last. She came in, she had bleeding gums, broken teeth, loose teeth. Sedation got her there. This is the final result for her, and she couldn't be happier.
They look nice.
They look great.
So you're in on the design of those teeth?
Yeah, it's very much a collaboration. So we've got thoughts and a direction that we need to go in from a dental standpoint, of course. Mm-hmm. Patients always have input. A lot of times they'll come in and they'll bring a picture of themselves when they were 20, 25 years old. And they'll say, can we go back here? Of course we can. This is your chance. Start fresh.
Okay.
Yeah.
Now, you know, we're talking at the top of the show, like extreme smile makeovers, but it's sedation.
Sure.
So, you know, at the top of the show, I said that you said this. So can you ever be too far gone to get a brand new set of teeth? I mean, what if you have bad gums?
So, look, we can clean up the gums, we can fix the teeth, and we can get things healthy again. There are different ways to get people back to where they need to be.
Now, once they do sedation dentistry, and I'm speaking a little bit for myself, I only get nitrous.
Sure.
But it's like you're stuck. It's like the only way to go.
Yeah, I know.
I've told everybody, I said, if you go to the dentist, demand some sort of sedation.
Yeah, absolutely.
Makes it so easy.
We've got patients that'll come in and have sedation. They'll have IV sedation for things as routine as a cleaning.
Really?
Okay. Absolutely, very much so. Look, when patients come in and they're comfortable and they're happy and they're healthy, we want to keep them going the way that they want to go with it.
Okay, good.
Yeah.
Time for another photo.
Okay, great. So she came in, she didn't like her smile. Over the years, you can see she's had this tooth fixed this way, that one is that color, this one is in a different position. She finally said, you know what, it's enough. Can we make some big changes?
Did she have fear of the dentist? Is that why she wanted sedation?
She had a big fear of the dentist. So she was going in, fix one thing at a time. I said, you know what, we got to stop and take a bigger step in the right direction. She was thrilled to hear that. Some people never get asked that question. Do you want to do something better than what you've been doing?
Like they come in, just fix this tooth.
Yeah, absolutely.
So rather than just doing that, you're obligated to tell them.
Sure. Some people are never asked the question. Some people never hear, are you really unhappy? Do you really want some better options? People never hear that.
So you give them like a couple of different options.
You need to have that conversation with them. Yeah, very much so. And look at the result. She looks great. She is thrilled. She didn't realize she could look this way or feel this good.
Now, is it true, because you made the statement that you can do like 6 months worth of dentistry in one day.
You can.
Because of sedation.
You can.
What does that mean?
So what that means is patients come in, they're comfortable, we can accomplish a lot more. They're not sitting there worrying or waiting. Is something going to bother me? Am I going to have a sensation that's going to make me crazy? They're going to be very comfortable the whole way through.
Now, you deal with a lot of sick patients. I mean, people with a lot of problems. So what do you get with their medical doctor sometimes?
Thank you. So we do. So a lot of patients that come in that have significant dental challenges also have a lot of things going on medically. Our practice is made up of a lot of patients that have big medical issues, big dental issues. This is what we do.
Like they're on a lot of medications.
Yes, they're on a lot. 4,
and you can
5,
still
6,
take their pain away.
Without question. We have a lot of patients that are referred to our practice from other general dental practices because they say, you know what, it's more than I can handle, more than I'm comfortable handling. We're happy to help.
Okay. You know, I've had dentists confide in me off camera. They'll say, Randy, I hate these dental phobics. I just don't like to deal with them. Why do you like dealing with them?
Well, look.
Because you and your wife like dealing with them.
We have a very different approach, okay? Once we establish our level of comfort with them, their level of comfort with us, we get to the point where they say, you know what? It can be different. It can feel okay proceeding this way. Everything is different.
Okay, good. One more. And we're going to go about 30 seconds with this guy.
Great. Okay. So this gentleman is, I believe he's probably in his 70s or so, and he has had one tooth dentistry for years. In fact, when I met him, he had just had a tooth pulled a week or two earlier, and he was healing from that. And he said, you know, I think I'm coming in, I might need another tooth pulled. I said, where are we going with this? Are you happy taking these small steps? He said, not really. I said, well, let's have a different conversation. He said, there's a different way we can go with this. We had a different conversation. He had gum disease, he had cavities. We needed to take some bigger steps with him. And it has changed his life. It has changed his life. We spoke with him last week, changed his life.
And he had sedation.
He had sedation the whole way through, had some medical challenges. He is eating what he wants now. He is comfortable. His wife is thrilled about this. Couldn't be happier.
So they're smiling more.
They're smiling a lot more. They're smiling so much, they didn't realize that they weren't smiling before this was done.
So people notice.
People notice. People notice. A lot of times, we'll have patients that say, you know what, I forgot how to smile. I don't know how long it's been since I've smiled this much. And I had a patient come in and say, my face hurts, I'm smiling so much. We love it.
That's good.
Yeah.
We're going to take a quick break. We come back, we're going to have your wife on the program.
Wonderful.
And also talking about sedation dentistry. You say patients really like her.
They love her. Love her. She is warm. She has a great way about her.
Okay, good.
Yeah.
We're going to take I want to thank you for coming on the program.
Thank you.
Good stuff.
Appreciate it, Randy.
Good stuff.
Thanks.
You've been watching the Wellness Hour, news that makes you healthier. We'll be right back.
I was very nervous the first day and hyperventilating, and sort of they were very calming and walked me through everything, talked me through everything, and I fell in love with Dr. Deb. She's been amazing and really reassuring. Very willing to slow down and talk things through and explain what she's doing and how long things are going to last if it's uncomfortable and painful. And with the sedation, you know, you sort of wake up at the end and you don't remember anything. So that's a nice way of doing it. But I found over time that I don't even need the sedation for a lot of things because I'm so comfortable here.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, sedation dentistry. According to my first guest, she says, don't let your fear of the dentist keep you from having the smile you've always wanted, or your busy schedule. Because she says you can do 6 months, a year worth of dentistry in just one shot with sedation dentistry. With us, we have Maryland's sedation dentist, Dr. Klotz. Dr. Klotz, welcome to the program.
Hi, please call me Dr. Deb. My patients do.
Okay, so they call you Dr. Deb and your husband Dr. Rob.
Yes.
And you're a husband and wife dental team.
Yeah.
Met in dental school.
We actually met in college.
Okay.
Yes. So we've been together 24 years and in practice 10.
Okay, good. So for people that don't know your practice, like who's the typical patient that comes in requesting sedation in your practice?
Well, I can't say there's a typical patient, but everybody definitely shares some sort of fear of the dentist. But that could be because they are just too busy and they're afraid of wasting their time.
Okay.
It could be that they're just really terrified of all doctors, and so they haven't been to the dentist or their regular doctor
Do
in
they
more
tell
than
you this
20
on the
years.
consult?
Absolutely.
Like, I'm just afraid of doctors.
When people come in for a consult, we shut the door, there's a box of tissues. I mean, 9 times out of 10, the tears flow. People are scared, they're ashamed, they're just feeling terrible about themselves. Our practice, we don't judge. We've always seen it before. You're never our worst case, which is always what people think.
Do they really?
They do. Everyone thinks that I am the most disgusting mouth you've ever seen, and I'm so ashamed. That's never the case. I have a patient who hadn't been to the dentist in more than 40 years. He was so terrified, he couldn't get out of the car. We had to have my front desk come out to the car.
Wow.
And really just calmly coach him and talk him almost off the ledge. We brought him in. That first visit, we just talked. I didn't even look in his mouth. That's how terrified he was. So that guy who we coached him in through the car, terrified. That first visit, we did nothing. We just talked. Okay. We coached him through his smile. I mean, he was sleeping sitting up. His teeth were so loose, he thought he would swallow with them in his sleep.
Okay.
Yeah, I mean, he hadn't been in 40 years. So we coached him through. I mean, we took out the unhealthy teeth. He now has a smile. When he comes in, I can't even tell you. My front desk, it's like a party. He comes in. If we had wine, that's all we need. He's a joy to be around. He's a whole new man. And his teeth were really the thing that was holding back. He wasn't going to family functions. He had almost become a little reclusive because he was so ashamed. Now, I mean, he stops in just to say hello to us. He doesn't even have an appointment scheduled, and he stops in.
Now, we should mention your center.
Yeah.
Because you and your husband, Dr. Rob, Dr. Deb, that because of your training, I know it's not a recognized specialty or even a real term, but like this, it's loosely used, like super specialists.
Sure.
You do your own root canals, dental implants, cosmetic dentistry. I mean, pretty much do everything right there.
We do.
Is that right?
Do. It is, and it's evolved because we do sedation. People come in for sedation because they're scared. Now, we don't judge. You could be scared of just a cleaning, so we've got to be the best at that. But then you could be scared of a root canal, and so we have to be the best at that. So sedation really leads itself for us to be good at all the aspects of dentistry, because while you're sleeping, you can have everything done at once. You can have the cleaning, the filling, and the extraction all done at the same time. And that's the beauty of our multi-specialty training.
So you brought some photos. What are we looking at?
I did. And all of these photos are patients that really needed sedation to change their lives.
Okay.
They wouldn't have come if we didn't offer the sedation aspect of what we do. But let me tell you about this one.
All right.
She is a patient. She had not been to the dentist in a long time, and she had gum disease. And
I mean, that's got to be unusual. That looks pretty bad.
It's not unusual because, and a lot of people don't know this. People can manage not smile as big so they don't show the stain, they don't show the gum recession. But
Can you spot it, by the way, as a dentist? Like, you know who's hiding their teeth?
I do, of course. And people, I mean, a lot of times we have patients, husbands or wives, call because their breath is so bad.
Okay.
Something has to really prompt our patients to get in. This patient, it was her son's wedding, and it was the happiest day of her life. And she looked back at the pictures, and she wasn't smiling in any of those pictures. It broke her heart.
Okay.
So that's what got her in to have her care with us. Sedation transformed her life. She comes in now. We took out teeth.
Looks good.
Yeah, I mean, she looks fabulous. Okay. She really does. We took out her teeth. We made her healthy. We did a combination of procedures, but she walked out with that gorgeous smile.
Nice.
And she's over the moon happy about it.
Eating, chewing, whatever?
Oh yeah, the testimonial on my website she wrote, it's like, it's beautiful. It really changed her life, and you could
Now,
read
people
it.
need to know, I'm not trying to side with you on the show, but I did look at your website. It's like a patient after patient after patient. It seemed like they were exaggerating a little bit, because I couldn't help but think, it's just teeth.
No, I
You
know.
say it's more than that.
Oh, I mean, it really is. It changes people's lives. I have a patient who, he was in sales. He does like convention sales. He was so down on his teeth after seeing us, after redoing his smile, best year in sales ever. And I mean,
So it's what, the self-confidence you think that's changed?
Absolutely. I mean, studies show Men's Health, Elle magazine, every research on what are the most the things that make people feel most confident or look most attractive. Smile's always number one.
That's a good point.
Yeah.
That's a good point.
Yeah.
So you think the smile's pretty important?
I
Because
do.
you're a dentist.
I do.
But beyond that, you've seen it, right?
I see the results.
Okay.
Number one in sales. I mean,
But everybody hates going to the dentist, right? Is there anybody out there that actually says, I like going to the dentist?
yeah, my patients who come for sedation and they feel like it's a little vacation every time they come.
I told
the
you that,
busy
yeah.
mom.
I do nitrous. I have no fear of the dentist, but it's so nice.
It is great. And we have patients that leave, or they come and they feel like they're coming almost to a little party because they get so excited and relaxed, and then they leave. And I mean, we've retrained them. They feel so comfortable in coming to us that they're excited. Over time, they're happy to do it. We've retrained them to not be afraid anymore, and that's always our goal.
And you're on the radio a lot, right? I mean, a lot of people hear about you as a sedation people and dental implant people from
Yes,
radio.
yes. So sedation patients, they're not talking about it amongst their friends. It's not like I have this great doc who can put me to sleep for their care. A lot of times they're feeling a little down about it, a little ashamed that that's what they need. So the radio ads they talk to them and they say, you're not alone. We can take care of you. And that's how people hear about us.
Okay, good. Another photo. We have time for another photo.
Oh, yes. Oh, this beautiful. This patient, gorgeous.
Okay.
She tried whitening. She even tried braces. She said, it's not you, it's me. I'm divorcing braces. I need another option. We took care of her same day with sedation, same day, and
So is
she
it a
walked
pill? I mean, what is it?
So it could be a pill, but that isn't the most effective way for sedation. The real way to get the best sedation visit is to do IV sedation.
Okay.
Because you're going to be in control. We're going to be in control of your experience from start to finish. So if I want you a little more sleepy, I can just give it to you,
more,
and I
okay.
can wake you up. Same concept.
So they could do a lot of stuff. That's how you're able to do this in one day.
Absolutely. And that was her case. With her, she had a little sedation and she woke up with that beautiful smile. And I will have you know, we started her case. If you see her before pictures, you won't recognize her. She lost 30 pounds and I mean, sexy and gorgeous.
Because of her teeth? Because of her teeth?
Yes.
Or is it what's like a boost in self-esteem?
The whole concept, my teeth look good, my body has to look good. She's
Good.
dressing different. I mean, she's gorgeous.
Okay, nice. One more. And I'm not trying to rush you.
No.
We have a couple of minutes left.
No, I'm in love it. This is so exciting. This patient, grandma, busy, healthy woman, one of those, if it's not broke, don't fix it. So she hadn't been to any doc in probably 20 years. No dentist, nothing was hurting her. Although what brought her in is that something started to hurt her.
Okay.
So she came to us. We, with sedation, were able to, in just a couple visits, and she was one where we took along the journey. She comes in now, she stays for hours, just chatting it up. I mean, she's beautiful. She actually also just wrote a beautiful testimonial on the website.
I mean, that's a good looking smile, by the way.
I know, and she's a gorgeous woman, and I mean, her husband said she talks a lot and she's super excitable, and her husband said before the teeth she was a little calmer. I don't know what the teeth did, but I can't shut her up now. Oh, this patient, oh, bless her heart. I'm going to start at the end because We finished her case, and sadly, her husband passed away just shortly after we finished the case. Oh, we were devastated, sent cards. She told us after the funeral that she was so thankful that she had the teeth for the funeral because she was smiling. It was like a tribute to life for him. And she really felt like if she had not been smiling, it wouldn't have honored him in the way that she wanted to.
That's very nice.
And that touched my heart because here I was thinking, you know, she would not feel like she had enjoyed them with him enough, but she was so blessed that she was able to even have him and give him that smile of hers.
Very, very nice. So the people that come in, I guess it's, you know, when we say things like that you could do 6 months worth of dentistry in one meeting, are we talking about it's just because they could spend more time in the chair because they're relaxing?
Yes.
So you could do a lot of things?
Absolutely. And another added benefit of sedation, so yes, we can get a lot done while they're in the chair sleeping, but also their body's not getting stressed. So post-operatively, patients heal better, they heal quicker, because
there's less stress.
There's less stress. Free radicals are released when you're in stress. You're not having that. No back pain. There's so many benefits of sedation.
Okay, so you've got the mask or the nitrous.
Yes.
Is that right?
Yes.
You've got a pill that they could take. You say some people even have to take a pill before they get there. Is that true?
Yeah. Some people have to take a pill. You know, a
you
week
prescribe
before.
This.
We do. A week before to help them sleep in anticipation of these visits.
Is that right?
Yeah.
Now you say there's like a transformation that happens, like people that were very afraid of the dentist, now they're not afraid. You see them over time or they're not afraid.
My goal is always to sort of get them slowly to be more comfortable with what we do so that at the end of it, they don't need sedation. We're happy to do sedation for whatever you need, cleaning to an extraction. But my goal is for them to feel so comfortable with us that they come in like it's nothing. It's a whole new experience.
I mean, you love this.
I love it. I do.
Because your husband said that you're even at like basketball games, like with the kids.
Oh yeah.
You're talking about dentistry.
Absolutely. And sadly enough, if we have to come in on a Saturday for someone who needs us, my kids are beyond excited to come and help assist. And yes, we love it. It's our life.
We're out of time. Final message to somebody watching this.
Yeah.
They're afraid of the dentist, or maybe they're too busy. Maybe they haven't been to the dentist, as you say, in 10, 15 years. But for whatever reason, they're even afraid of even sedation. What do you say to them? But they hate their smile.
Sure, and I'm gonna tell you that sedation is easy. So if you don't like something about your smile, change it. If you don't be too busy, don't be too scared. We do this every day. We have seen it all before, and we can handle whatever you're bringing to us. So come in and get it taken care of.
Okay, so they ask for Dr. Deb, Dr. Rob. You both have the same training.
We do.
And you work together every day.
We do.
Good, good. So no more fear of the dentist.
No, fix it. Do it.
Okay, good. I want to thank you for coming on the show. Great stuff.
Thank you for having me.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez for now. I wish you could help.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.